Hi, it's good to see you again. How are you doing? You're doing good? Alright, as you know, this is your second cranial nerve exam. We had your one last week, and I wanted you to come back in a week because some of the results from last week weren't perfect. So, wanted to see how you were doing over the last week, see if there were some improvements. You made the appointment with the neurosurgeon? Not Dr. Davis. He's excellent, one of the best. And that's on Friday. Alright, perfect. I will email him last week's results, and I will also email this week's, and I'm going to want to see you back regardless of these results 3 weeks from now, just to make sure everything's still going well, and I can relay that over to the doctor as well, to your neurologist as well. You know how this all goes. Obviously did it last week. And, just when you get a concussion or anything, we just like to, make sure and keep an eye on it for at least a month, just to make sure everything's going right, and even a little after that as well. Because symptoms, even from concussions, obviously will start off immediately, but they could also linger or get worse. So we just want to make sure it's not getting worse, and that it's getting better and it isn't lingering as well. Have you had any headaches over the past week? 2. And were they terrible or just, basic headaches? They were about average. Nothing. You didn't puke or nothing like that? All right, that's good. Well, like I said, you'll get them. The headaches will come, unfortunately, with concussions. Hopefully, over time, and when you come back in 3 weeks, you'll be down to none, maybe 1 or maybe even 2 over that span. But hopefully not more, because as you said last time, you were not a big headache sufferer before the accident. So the headache's coming, or it's natural. We just want to make sure it's not going to be worse. All right. Well, I'm going to start again with the olfactory nerve, your smell. I'm going to give you the three smells again. They will be different from last time, and last time you got 2 of the 3. So hopefully this week you get all 3. All right. Let me start off here. I just need you to close your eyes. Perfect. All right, just take a nice whiff into this. Enough of that. Right, can you tell me what that was? Yep, garlic. Perfect. We always start off with a strong smell. Sometimes a little too strong. I know garlic can be a little much, but if you weren't able to get that one, that would not be good. Okay, here comes the second one. Same thing. Just close your eyes. Take a big whiff for me. Tell me what that was. Yep, chocolate. Perfect. All right. Keep those eyes closed. And here comes the third one. All right. Get a good whiff. Can you tell me what that one was? Vanilla. Excellent. That was actually the one you missed last week, so there is definite improvement there. I'm very happy to see that. Excellent. Let me just... type that in. All right, great start. All right, now I'm going to go to your sight. Real quickly, I just want to shine this light into both eyes just to make sure they're constricting, expanding properly. All right, you ready? It's going to be a little bright. All right, here we go. Perfect. And this side. Excellent. All right, we're going to stick with the light. I just want you to follow it around real quick. Just move it. Don't move your head. Just look forward. Look at me straight. And just follow the light around. Nothing too crazy. All right, here we go. Excellent. Perfect. All right, perfect. Okay. Now, I want you to look forward still, right at me, and keep both eyes open. And I'm going to have my fingers here, and just tell me when my fingers go out of your line of sight. All right? Here we go. Yep. All right. Now if you can cover your right eye, and same thing, just tell me when it goes out of your line of sight. Perfect. Okay, same thing, cover your left eye for me, please. And here we go. Perfect. Alright, I'm going to stick with the eyes here for another minute. I want you to cover your right, and I'm going to hold up fingers from both hands, and I just wanted you to tell me how many fingers I'm holding up. Alright? Alright, here we go. Yes. Perfect. Good. Excellent. Excellent. Alright, good. Same thing. Cover your other eye, and we will do the same thing. Alright, here we go. Perfect. Good. Yes. Excellent. Perfect. Alright. Your eyes were fine last week, and they're still fine this week as well, which is good. There's no, it has not gotten worse, which is excellent. Just get past that one, type it in. Perfect. I'm a little bit jealous of your eyes. I got one bad eye myself, as you can tell from the glasses. This lens is quite thick. Alright, so your eyes are perfect, and your smell has improved, which is great. Alright, so now let's just go on to some basic motor functions in your face. I know you said you had a little pain with a few of the little tests we ran last week. I want to see if that pain is not present this time. Alright, so if you can just lift your eyebrows up as high as you can. Excellent. No pain that time? Alright, that's great. Last time you said you had a little bit of pain, and it was a little bit of a strain to do it. Excellent to hear that that is not present this time. If you can clench your jaw for me. Alright, and quickly just turn while your jaw's clenched, just turn your head to both sides for me. Alright, perfect. Alright, keep your your jaw clenched. And I just want to quickly feel. That doesn't hurt at all. Okay. Perfect. Alright, you can relax. Alright, I'd just like you to also puff out your cheeks like this. Alright. Excellent. No strain or pain there as well. Alright, good. Okay. Just want to also study for any involuntary movements or anything. So just look at me. Alright. Perfect. Now if you can smile, but keep your lips closed and smile like as high as you can. Alright. Perfect. No pain there as well. Alright, that's good. You haven't had any pain in the facial area or anything when you've done anything, if you smiled or laughed or anything. There's been no pain. Alright, excellent. Okay. Alright, perfect. Alright, now we're going to do your hearing. Your hearing was also fine last time, but we just want to make sure it still is. Okay, so I'm going to start by whispering 3 numbers in each ear. I want you to repeat them, and then I'll do 3 words in each ear, and I want you to repeat those back to me. Alright? You ready? Alright. 2, 7, 4. Yep, perfect. This ear. 9, 1, 8. Yep, exactly right. Alright, perfect. Now let's move on to the words. Same thing, 3 words each ear. Just repeat them back to me. All right. Apple. Chair. Window. All the words? Yep, excellent. All right. Next to you. Pillow. Wall. Couch. Perfect. All right. Now I'm going to stick with the ears briefly here. I just want to make some noises in each ear, and I want you to tell me when the noises stop, when you stop hearing the noises. Okay? All right, here we go. Perfect. All right, next ear. Excellent. All right. Your ears seem fine, which is good. You haven't had any pain in the ear or anything like that? No ear pain? All right. Excellent. Let me just type that up. All right. Last test here is just some basic little things here, as you know from last time. Same as that, I just want you to quickly raise your shoulders. Give me like a nice shrug, raise them, and then drop them. All right, raise, drop. And one more time, and drop them. All right, nice. And there was no pain from that as well? All right, excellent. All right, we're gonna do the same thing. I want you to raise them, but this time I'm gonna try to push them down, and I want you to just resist. All right? Okay, here we go. All right, so give me a nice raise. Excellent. Okay. And there's no pain from that. There was no struggle or anything for that. All right, perfect. Okay. All right, so I want you to now follow my finger, but I want you to turn. Keep both eyes open and turn your head whichever way my finger goes. All right? Are you ready? All right, here we go. All right, perfect. And then, like I said, same thing as with the earlier test. There was no pain or strain when moving your head both ways, and you didn't struggle or anything to see the finger or anything like that. All right, that is perfect. Okay. Well, I'm happy to say that this week was a lot better than last. You didn't do terrible last week, but there were some things to maybe show a little concern with. But they both, you've improved. The smell improved. You got the same one you missed last week, which is good. You have less pain in the face, which is excellent. Your hearing, your sight, your other motor functions, all fine, which is good. So there's no, it didn't get worse, so that's good. And I will send over both last week's results, this week's results. I'll send them over to Dr. Davis for you. He's great. He'll get real in depth. This is just the basic stuff, just to make sure nothing's terrible. There's no underlying problems, and then he will go really in depth with you. He'll know if you need any more scans or anything like that. He's very good. You're in good hands with him. And I will send that information over to him. I want you to see it back in 3 weeks, just to make sure everything's still going well, and there's no headaches or anything like that, and and nothing's gotten worse or anything. It's like I said, with concussions, depending on the severity, things could linger a while, or they could get worse, which is not good, obviously. We just want to make sure you're steadily continuing to get better. In the meantime, if there's any problems, call me or call him, and he'll give you any information you need. If anything gets out of control, just go to the ER. Don't sit around or anything like that. Just if something does not feel right, and it's late at night or something, just go there, or you can come here if it's during the day. But don't sit around, it's just not good to do that. Don't hope things go away on their own. If you didn't have a concussion, I'd say sure, it's probably a basic headache or something, but you did, so you want to be safe. It's better safe than sorry in these instances. Okay, so it was great to see you again. I'll see you back in 3 weeks, and I'll send this information over to a neurologist, and I hope everything goes well with him. Very excellent to see you again. All right, enjoy your day. Thank you.